Hi, everybody, and thank you very much for being here today for Deborah Kobylt Live. I have a guest in studio with me that I'm very excited to talk about, Talitha Phillips. Thank you so much for being here. You are with Claris Health, and later this month, you're going to be launching a mobile health clinic, right?
Yes.
This is wonderful. I didn't really know much about Claris Health until I started talking to you and looking into it. Why don't you tell us, first of all, what is Claris Health and what do you do?
Yeah, thank you. So Claris, the word Claris actually means clarity. And we are all about bringing clarity to what can feel like confusing situations. We, for the last 40 years, have been working primarily with women that are pregnant or think they might be pregnant and families with children under the age of 5. We do medical care, prenatal care, STD testing, and other general sort of health screenings.
It sounds sort of like what Planned Parenthood would do, no?
Yeah, we offer some of the same services. Our specialty, though, is more in parenting, adoption, and post-abortion support services, but a lot of the same education and some of the same women's health services.
That's wonderful. So where are you I know you're basically in Los Angeles. Where are you located around LA?
So we have a clinic in Inglewood on the campus of Centinela Hospital, and then in West LA. And then we also have a support center where we do a lot of classes and educational services. It's also in West LA.
What kind of clients do you get? Because when you said West LA, I thought a lot of people in West LA, they got their private doctors, they're going to Cedars and St. John's, and you said, not really, right? You'd be surprised. You get a lot of women coming in there from all over Los Angeles, in particular West LA as well.
Exactly. Yeah, our population in West LA is a little more diverse, so we have people that travel far to come to our clinic, but we do have individuals who are low income. We have, middle class individuals who might not have insurance and need that support,
which is so
to
important.
Get them through that season, definitely. And then Inglewood, the population is often a little bit younger. Definitely a large percentage are African American or Latino. And so we've been serving in both those communities. We've been in Inglewood for almost 10 years and then in West LA for 43 years.
Wow. So when you say, what's the average age, actually, the person who comes to for your service?
It's a pretty big range. In Inglewood, anywhere from 16 to 24 would be average.
So fairly young ladies.
Fairly young, yeah. West LA is more like 18, 19 to 35. Quite a
What I found interesting, you said, particularly in West LA, sometimes, some women might not want their doctors to know what they want to get tested for, and they want to just be private. So they come to Claris Health, and you'll do that. Everything's private, of course.
Yeah. Private and free. You don't have to have insurance. We don't require insurance. We don't reimburse for services. So it's a nice opportunity. We also take walk-ins so people can come in. A lot of times there's a delay. Even if you have insurance, your provider may not be able to see you for 4 to 6 weeks. And so some women
This is so true.
Need results earlier so they can come to us and get started. One of the statistics that has really hit us hard is that 22% of women in South LA don't get prenatal care in the first trimester. And so when we heard that, we realized there's such a need for early intervention. And so we've made, you mentioned earlier, a mobile initiative, but we also launched a specific prenatal care program that's targeted at helping women get early care. It's an evidence-based program that helps reduce rates of maternal death and infant mortality. So.
That's unbelievable that you offer this, and all free of charge, which is incredible. So basically you've got testing, you've got counseling, and you counsel women through their pregnancies and post-pregnancy. What I also love is you speak to women about adoption for women who may be on the fence. Tell me a little bit about that.
Yeah, so we believe in helping women understand that they have options, that there's never just one option. Often when a woman feels like she just has one choice, she feels trapped.
Yeah.
And we all know that when you feel trapped, you sometimes make decisions that later you wish you hadn't or wish you had known that there were other options. And that's true in my own life. I started at Claris as a client and came for counseling and just saw how much they loved me and saw value in my life and sort of instilled some of the things I had forgotten. And it really changed the course of my life. And so I hope that other women would know that. And adoption is an option for a lot of women. And I think in our culture, we've often either misrepresented adoption or you hear the horror stories on both sides. And so we believe in just sharing beautiful stories, hard, raw, real stories, but also allowing people to talk about their experiences from their perspective without being afraid of that. So,
do you also find matches for people, or you just counsel people who are interested in going that route?
We don't. Our goal is just to be there for people who are in these situations, to be an advocate for them. So we don't represent families, but we work with agencies. We have over 200 community partners. So if somebody's interested in adoption, we connect them to somebody that specializes in carrying them through that process, and then we're able to be there for them emotionally, to be a sounding board, to counsel them through that. It's interesting, after adoption, a lot of women have similar grieving symptoms, right? There is a loss that is there, and they need to know that they weren't just there to provide a child for another family, that their life matters and that they need to have a support team that's there for them. It's very difficult in those weeks, months, and even years.
I can't
after.
imagine. I really can't. I was just talking to a friend the other day, and she had adopted a child, and she has a complete open adoption where, her child knows her birth parents. And I would think, I would be almost a little nervous to do that, but she said she wanted it that way because she didn't want so many questions later on. And there's just so many options, as you said. And if you're counseling people who are confused, that's so valuable. Do you also offer gynecological visits as well, or is it mostly testing?
Mostly testing at the moment. Yeah, we're hoping to expand more. We do pap smears and some basic women's health screenings, but we haven't launched a full gynecological program yet.
Mental health as well?
Mental health, yeah. We have marriage and family therapists and interns that work with us. So anyone that comes to us is offered an opportunity to do that. That's also free, which is very unique. And we have some donation-based services, but for the most part, we want them to know that there's help. Sometimes you think you come in because you might be pregnant, and then you realize you're actually dealing with a lot of relational issues, or somebody in the past has placed a child for adoption or has something deeper that they want to work through.
I think that's fantastic. How many people, mostly women, of course, do you serve a month or a year? It's grown.
Yeah, it's grown a lot. So on an average in a year, we see about 1,400 to 1,600 people in our clinics. And then in the community, we do a lot of sexual health education and reach another 7,000 to 8,000 young people. And that number is growing. Yeah.
Are you going into schools as well, and tell me about that?
Yeah, so we go into schools. We have a sexual health and relational health education program that talks to young people in private and public schools. We go into organizations such as Homeboy Industries. We do court-mandated parenting classes. That's been something that's been growing. So we've worked with correctional facilities. We've worked with group reentry homes, and a lot of organizations where either a child has been removed from the home or is at risk of being removed. And our goal is to help either reunify families or keep families intact whenever that's possible.
The counselors you get, are they, is this on a volunteer basis? Or because you must have quite a staff to provide all of these different services, from medical to mental health services, counseling. Tell me about that.
Yeah, we actually have a pretty small staff for all that we do. We have about 20 people on staff, and half are part-time, and then about 100 volunteers.
Yeah.
So a lot of volunteers. Our therapists are either on staff or they're getting their hours, and so it's more of a volunteer basis. And our medical providers are largely all on staff. But, yeah.
Tell me some of the greatest need. You've been doing this, over 24 years? About 24 years?
I've been doing this 18.
18 years.
18 years,
You were 24 when you first went there.
Yeah, 23, yeah.
I'm getting my numbers mixed up.
Close.
So
Good.
You've been there for 18, almost 20 years. How have things changed? How have the needs changed with women?
Yeah, a lot. They've changed a lot. When I first started, we were a small organization that largely just did counseling and provided, basic parenting classes. And our budget was small; it was $90,000, and there were only 2 part-time people on staff. And we grew as we looked at the needs of, gosh, there are people who are in these situations who are trying to make a decision, but in order to make a decision, they need to know that they're going to be supported after.
Yeah.
And gosh, what about before? Could we help prevent some of these situations? And so our model grew, and we started looking at we need to be there before, during, and after. And so as we've grown, our services have grown tremendously, and so has our budget, obviously, and our staff. And then looking at the communities. We used to just be in West LA, and we realized, gosh, we need to go into where there is the greatest need in the city and not expect that people can get to us. So that launched our first satellite. We used to be in the Crenshaw district, now Inglewood. And then that has propelled us now to realize, as we've looked at the city and looked at the needs of homelessness and trafficking and maternal death and infant mortality and addiction, and we've realized there are entire communities of people who can't often leave their community. They don't have transportation. There are communities who culturally have a mistrust of the medical providers, or they're afraid of their documentation status. And so we've discovered that we need to go where they are. To truly serve the city of Los Angeles, we have to go to where the need is.
Therefore, the mobile clinic that you're starting up this month. Tremendous. Tell me about that.
Yeah, so we started getting requests a couple years ago from a housing project in Compton and Watts, and they said, we need general health screenings and we can't find any medical providers to come in here. And somebody said, it was actually funny, somebody said that Claris would probably be willing to do it, and so we thought we'd ask. And so we talked to our board and we said, sure, let's give it a try. And we were blown away by the need, but also the opportunity to build a relationship. We were going in once a month, so we were getting to know the residents. We were getting to know their families, some of their health needs, and realized we need to do more than general health screenings. Many of these women are pregnant. They are in their first trimester. They're not getting care. Yeah. Some aren't finding out that they're pregnant till they're 5, 6, 7 months. STD testing, the rates in the county are growing rapidly and primarily impacting women. So we're like, and if you can get tested early, you have a better outcome for treatment. Well,
so if you have the mobile clinic, how do people find you? How do they know where to go? And also, are they a little embarrassed to sort of walk into the clinic? Are they going to look around? Or, how do you prevent all that, too?
Yeah, so our model is a little unique. What we did is we first went and did a feasibility study with all of our partners, and we said, if we had a mobile, would you want services? And I think within 3 days, we had 42 requests.
Honestly, I would go, because just waiting in the doctor's office gives me anxiety, and I'm really not kidding. Particularly, my gynecologist, my obstetrician, it's like, oh my God. Boy, I'd go in there. I mean, honestly.
Yeah, and it's beautiful. And so part of our design was we want to, create this state-of-the-art vehicle. This isn't a food truck, right? Like, this is a beautiful, like, you walk in and it looks like our clinic. I mean, you're greeted with coffee and tea, and the floors are beautiful, and everything's clean, and there's somebody to first meet with you. We believe in first looking at the emotional needs, like, how are you doing? Meeting with somebody that's not clinical in scrubs. You meet with an advocate who just asks how you're doing, why you're there, how we can help, and then can provide case management. So we now we have 27 sites that we've partnered with. So we're not driving this around and just parking it in a lot and hoping people will come. We're saying we're going to these strategic partners who have clients or patients who need these services. So they're going to do the scheduling. We'll come in and we'll see their residents or their patients or their clients. And then, and part of that is so there's a trust. They already trust the agency that they're with, right? So we're coming in and they can confidently get in and know that we're going to love them well and serve them well because of where they're going.
Tell me some of the agencies, like you say you're partnering with, but who are they?
Shields for Families is one. The Dream Center is another. Avalon Gardens is a housing project. And there's a long list. We actually have a website, our link you can go to. It's clarishealth.org/mobile. Some of our partners are listed there, some of the sites. Some will eventually be open to the public. Others are a little more private. We're working with PATH. There's a lot of homeless providers that have secret locations because of the population that they deal with that they want to
And
be
you've
private.
got one mobile, right?
Just one, yes. We started fundraising less than a year ago and built this custom vehicle and did everything within about 9 months' time.
That's exceptional.
Yeah.
Now you do quite a bit of fundraising. I know that you've got a private fundraisers like later on in the month, right, at the Skirball by invitation only. But clearly, people can donate and help who hear about this. I mean, women's health is so crucial. You know, most of us, especially when we were younger, we're a little afraid to reach out, afraid of our parents or our partners. You know, so. That's fantastic. So they go onto your website.
Yeah, they can go onto our website. We have a gala on October 19th at the Skirball Center where we're going to be featuring the mobile for people to tour for the first time. Several people that came to our gala last year gave some of the seed money to build this. And so it's exciting that they'll come and walk through it. And then our first service date is the following week. October 24th is the first day that we're in the community.
Where will you be?
We'll be at Shields for Families that day.
And then do you just take it different places every day, or how long will it be at one location?
Yeah, we're starting about 3 or 4 days a week, and then eventually we'll hopefully graduate to more. It's licensed as a satellite clinic, so it'll be functional about 30 hours a week. And yeah.
You do. This is very reminiscent of what goes on with Planned Parenthood. I know that all of your funding is private, which is terrific because we need so many organizations to help all of us.
Yeah.
So many of us just want to quietly get care. And you turn no one away, right? Absolutely no one.
We don't. And it's one of the nice things about not taking public funding is that we don't have restrictions. So it doesn't matter what your zip code is or your income level or you know, how you found out about us. We'll see and serve anyone. And we do have services for men too, and entire families. Our goal really is to serve the whole family. So STD testing is not just for women. We offer those services to men as well.
Right. We should be very clear about that. So if any male wants to come in as well, he's most welcome, right? Can he also get blood work done? But primarily, I know this is a safe haven for women to go to, but men can also get testing.
Yeah. Yeah, we would encourage a lot of the women we see, we encourage their partners to come and get tested as well.
Yeah. Oh, this is just fantastic. Anything else you'd like to add to encourage people to come and find you?
Yeah, I would say just look at our website. We also have incredible testimony videos. We have a YouTube channel, so you can hear from some of the lives that have been impacted. It's always much more
That's phenomenal.
important.
When I looked at that, I thought that was pretty terrific. Very, very special. But thank you very, very much for being here. We're going to push the word out, and please look up Claris Health, right? .org, and look for the bus. And will you have the locations on your website so that people can come and find you, or?
We'll have some, we have some community flyers up on the sites that we can publicly announce. And I think those will grow, so stay tuned. Keep checking back. There's also a fun video. You can see just the transformation of the mobile. You can see what it looks like inside.
Did you put a picture of that up? That was pretty incredible. That was I love there's the outside. That's so, I mean, it's very friendly, right? At first it looks like a little kid's bus, and I thought, like those mobile buses where you get the books.
Yeah.
And it was just friendly, and it's a happy place. So the pictures are lovely on the inside. It's safe.
Yes.
I love that you offer coffee and a smile and people walking in, because, as I said, even myself can be very anxiety producing, for any of us. So thank you very, very much for being here. I appreciate you sharing a little bit about yourself and about Claris Health. And please go on their website, clarishealth.org. And if you'd like to donate, I know their gala, are tickets still available, or is it private only?
We don't sell tickets, but we may
Right.
have some seats available. So if you're
You may have
interested in
seats.
attending,
Okay.
give us a call or email through the website.
Or donate. If you like what you hear, read more about it, give them a call, show up. I mean, it's the best way to get involved, right? If you hear this and you just find this to be something interesting, get involved, please, because we all need it, right?
Yes.
Anyway, thank you so much for being here, everybody, for Deborah Kobylt Live. And we will see you next time. Remember, you can hear our show on iHeartRadio, on Apple Podcasts, Spreaker, Spotify, and you can watch us on YouTube, Facebook. We put all our promos out on Instagram, Twitter, everywhere. Anywhere you get your podcasts, you'll find us. So thank you so much for being here for Deborah Kobylt Live, and we'll see you next time. Bye.